Good morning, everyone. It is May 26th. I'm Bob Ravenscroft, the Vice President for Advancement. Got a couple of things to share with you today, and there'll be some important information coming out later this week with scheduling and stuff that we'll ask for your help to disseminate. So let's start out. Our overnight census was 412, which is a pretty comfortable number right now. We're in single occupancy in our mental health and independence center, so frankly, it's a little bit more normal than you would think because of the single occupancy, where we usually have double occupancies in those areas. On June 1st, Bryan Life Point Fitness Center will be reopening with a lot of precautions. And then John will share a little bit about phase 3 of surgery discussions that are going on and what that might mean to visitors. Very premature right now, but he'll touch on that. Let's get right to our numbers. At Bryan, we have now administered 8,673 tests. Sadly, we've grown to 1,179 positive results, and we have 334 pending. So with that, I'll turn it over to John, and we will address questions afterwards.
Thanks, Bob. I thought we would talk about the numbers a little more. Just to give you the percent positive, so through our drive-through, we're at 13.6%, at the hospital 12.5%, and at our urgent care 11.9%. We have 24 positive COVID patients in-house. 16 are from our county, 8 are from outside of our county. 10 of those individuals are on ventilators. 10 of them, of course, are in our intensive care unit, 3 in our progressive care unit, and 11 in our general care unit. Bob talked a little bit about our surgeries and continuing to open those up. We'll have a meeting later on this week with our medical staff. It looks like so far we've been handling the increase in volume very well. We're looking at the potential of next week going to a phase 3, which would be opening up more surgical cases to occur at the hospital. At the same time when we do that, we've been having a lot of discussion about our visitor policy. That will be looked at as well this week, with an announcement coming out by the end of the week of allowing more support individuals for our patients, specifically for our surgical patients, as we continue to open that up. With that, we'll take any questions via chat. I'd have to go back and look at some of the numbers, but I believe 16 from Lancaster County may be the highest positive COVID patients that we've had in-house. If you recall, we were taking a lot of patients from outlying areas, and I think some of those have kind of simmered down a little bit. So now we're just seeing kind of the natural trend of what's happening. And as you've been looking at the trending, we seem to be around that mid-20s to upper 20s of positive COVID patients in-house. So we do think that we're kind of stabilizing at this point in time, but we can't stress enough to everybody: social distancing, self-isolation if you believe that you are COVID positive, or if you're waiting for your test results. Just continue to do those things. Mask wearing, very important. Washing your hands as well. Of the 10 patients that are on ventilators right now, 6 of those are from Lancaster County. That's really hard to say. I would say we're definitely seeing a leveling off, which you hope would be an indication that we have hit that peak and it's stabilizing. But as we've shared in the past, you know, it all depends on keeping this out of the assisted livings and nursing homes, because those are the patients that you see becoming more severely ill because they're already compromised, or just elderly in general that may be at home. We've got to make sure that people are checking in on these individuals periodically, and doing that by phone or doing it by FaceTime is a great way to do it, instead of just having them exposed to other individuals. So as far as now, we would say that, yeah, we probably are stabilizing, but it can just go the other direction if we don't practice what we've been talking about. Yes, we are. I mean, you know, our whole goal is taking care of the people. in this entire region. And we work closely with those hospitals as well. So if they feel that they need to transfer anyone to this organization, we will take care of those individuals.
Our physicians are meeting later this week, and once we get word from them, we'll share with you exact details of what Phase 3 means beyond longer inpatient stays and the implications for visitation.